With his vast experience and insight, we are truly honored to have him with us today. Please join me in extending a warm welcome to Dr. Amit Rangnekar, sir. I request Yashwant Mishra, sir, and Vijay Charlo, sir, to welcome Dr. Rangnekar, sir.
Sir, please come. Sir, you're able to see the presentation. Yes, that will be great. Please come down.
Good morning. Thank you, Dr. Dikshit. Thank you all the staff of SIES. Thank you all the dignitaries and thank you all the students for inviting us. And thank you to LPC as well for extending the invitation. Instead of having an extempore presentation, I just thought I'll make a professional PPT presentation. I'm not going to talk much about AI, but I'm going to talk about what's happening in the industry at the international level, at the global level, India level, for the company which I work, Centaur Pharma, and our brand Synarest. I'm going to do a small case study. So the next 15-16 minutes, I'll take you through the journey of what's happening in the world, as well as what's happening at Centaur and what's happening with Synarest. Just a small global scenario, just made a slide myself. Some of it is 2025, some of it is September 25, some is December 25, some is March 26. So I've just collated some data. If you look closely, these are the top 12, 13, 15 global companies. What I've given is the market cap, the valuation of the company. I've also given the revenues of each company. I've given the net profit of each company and I've given the net margin of each company. Okay, the next column contains their leading brand, what indication is it used for, and what is the brand turnover. Alright. Now if you look closely, you will see Eli Lilly, which is in the topmost place here, which is around 8th, 10th usually. But in market cap it is number 1 because they are very big in GLP or weight loss drugs with their drug called Mounjaro. If you look at their turnover, it's around 50 billion, but the valuation is around 900 billion. So 1:18 is the thing which they get. If you look at the net profit, it's 11 billion, but the valuation is 800, 900 billion. So 80 times to net profit is the valuation. And so big, so these are the changes which are taking place. So I'll just read out what's happening. I've just identified a few trends, a few opportunities, and a few challenges. So in terms of opportunities, in terms of trends first, the old guard versus the bio giants. If you look at all the Pfizer's and Novartis and GSK and Johnson & Johnson, which have been around for more than 100 years, and you compare them to the newer ones like Gilead or Novo or maybe Amgen, then that's where the place is, that's where the action is. Then what is happening today is one drug is used for multiple indications. So, yeah, I'll point out here, yeah. This Keytruda is the largest selling drug in the world. It's around 30 billion. But what is unique, it's for cancer. What is unique is, it has been approved for 40 indications in cancer by the US FDA. 40 indications, one drug. Can you imagine? It's an all-rounder like Kapil Dev or Hardik Pandya, complete all-rounder. So that's what is the change today. Then, this is the drug of Merck. Alright, 30 billion drug, one drug, 30 billion. So this is what is happening. If you look at GLP drugs also, which is for weight loss, many of them, some kind of galenical form, the patent is expiring. So what they have done is they have gone into now new indications like sleep apnea, neurological disorders. Post-patent expiry, they are trying to perpetuate the monopoly with new indications. But what is interesting is last week in India, Can you imagine how many brands were launched of semaglutide on one day? Can anybody imagine? 74. 74 brands were launched on one day. So look at the post-patent erosion which happens. So that's a very new trend which is taking place. And then AI-driven R&D. R&D would be defunct in a few years if AI really takes over, although it will take time. But all the processes, all the systems, all that would be AI-driven. And another threat to the industry is the robotic kind of indications. So I'll just delve a bit on that. R&D is leading to absolute cost crunching if you look at most of the companies outside. Now Pfizer has outsourced their R&D to a Chinese firm in terms of biologicals. Entire thing comes from there, a 6 billion contract a year. Can you imagine this is a 6 billion contract for a year or two, I think. But that's what is happening today. Entire biologicals come from there. So what are the opportunities today? India is big in generics. We are called the pharmacy of the world. 40% of US generics are from India. But what is important is generics is only bottom of the pyramid. There is a mid-level and there is a premier level. The mid-level which we have today is biosimilars. So biosimilars are very complex to make generics, but huge price points. So US, you have got Amgen, which leads in that, and Pfizer, of course. And Europe, you have got, in Europe, they have got Novartis. Novartis is the biggest in biosimilars. And in Asia, surprisingly, do you know who's the leader in Asia in biosimilars? Samsung. Samsung is the leader. So that's where the change is taking place. This is big money here. And above that is the biotech out-licensing opportunity. China leads here. That is the top of the pyramid. So that's where the real action is. All the American firms are tying up with China in that regard. China has gone much, much ahead in biotech. And in India, you only have Biocon and a few other companies over there. What is important as an opportunity is the aging population today. The number of people above 60 are more than the number of people below 10 years of age. It's a big segment. And emerging markets. The entire growth comes from markets like India, China, and Asia. That is what is happening. And what are the challenges? Of course, the patent cliffs which happen. The R&D output is dwindling. If you look at the number of new molecules over the last 20 years, they have reduced continuously. Today, more molecules which are there are follow-on molecules rather than breakthrough innovation. You also have regulations which are very stringent. Regulations is a big problem, as all of us who have US FDA facilities must have noticed it. Very stringent regulations. Very uncertain tariffs, geopolitical tensions, and litigation cost. I'll give you an example. There is I won't name the company, a big leading Indian company which was taken over. Before it was taken over, that year, 60% of its profits went in litigation cost in the US. Just imagine what is the cost. All that profits, what you make, 60% goes only in litigation cost. So that's a serious concern. So this is one slide. I'll quickly move on to the India slide. Three things. We are back to double-digit growth in India, domestic market. Our per capita income will be $2,700, which is towards affluence now. We should be doing $3,000. So what happens here is affordability, spending power, all that increases. And then we have higher lifespans. 60 plus population is 15 crore in India. 15 crore. 10-12% of India's population is above 60. Just imagine chronic therapy is booming. But chronic therapies are not above 60. They are maybe above 35 today. And that is the main thing. So chronic plus lifestyle is going to be the boom of the future. It's already there. So cardiovascular, diabetes, cholesterol, alopecia, hair loss. Everybody is trying to defy the natural aging process. So that's one big market. Second is the chronic market. Now what are the opportunities in India? In licensing. Biggest opportunity is in licensing, getting molecules from outside. Also encashing on the patent expiry. We have seen what happens to semaglutide. Then biologicals, biosimilar, vaccines. We need to trade up from generics to biosimilars, biologicals, vaccines. The rural market is a big opportunity. I read a report the other day that only 72% of India is actually penetrated by the allopathic market. It was 40% 20 years back. Now it is only 72%. So, very interesting article. There are 634,000 villages in India, out of which 70% villages have a population which is less than 1,000. And those are the places where there is no pharmacy. For every 10 villages, there could be a pharmacy. And the next action is going to be there. A lot of companies are having rural divisions now to penetrate. Medical insurance is a big opportunity. Only 1% is the penetration. But it is hospitalization where you get medical insurance. Tomorrow it turns to therapy and prescription. That's going to be a very big market. Today there is a lobbying going on for this. And that would really cushion the pharma industry. Challenges, of course, regulatory, DPCO, which I do for IDMA. So DPCO is a big problem, the price control, 18% of drugs are under price control. But any combination that you launch also comes under price control, so almost 25-26% comes under price control. The generics post-patent expiry erosion, a lot of Indian firms which market abroad, they feel the right, we have got exclusivity now for one brand. We went into the market, 3 months was the exclusivity. The moment the exclusivity finished in generics, can you imagine the erosion? The original product was $600. We launched at $60. Another Indian firm, just after the patent expiry exclusion, launched at $6. Can you imagine this? It's not our cost also. So that's a serious issue for or opportunity, which way you look at it. AI, robotic surgeries, that's going to prevent many diseases. So preventive surgery and all is going to be very big. It would obviate the need for prescriptions. Then we have tariff, geopolitical. But what has happened, very interesting, I think 19th was Gudi Padwa, right? Thursday, right? So we are the largest purchasers of paracetamol in India. We do 35 tons a month. That's our what we purchase, huge. The rate was around 265. It was originally 250 per kilo. It changed to maybe 265, 270, 275 because of the war. This was 18th of March. Alright, 19th was Gudi Padwa. Saturday somebody told us, "Arey, prices are rising. So we called up our suppliers. They said, we are not taking any bookings. Only Monday. Now every Monday we are going to open. So we said, fine, we'll wait till Monday. We called them. Can you imagine the price on Monday morning? 565. Straight from 265 to 565. Paracetamol. That is the effect this war has caused. We are not involved in the war, but we are getting hit by the war. That's the problem. Cascading increase. That's what is happening. So another point which is specific to India is, earlier we had general trade, now we have modern trade, we have underlying trade, we have Jana Aushadhi, we have generics, we have private labels, which is going to be very big. So let's quickly, I made one slide for you just to address this. This is the 250,000 crore market which India is. Okay, 250,000 crore, around 70 to 73% is the regular general trade market. So out of 250,000 crores, only 72% is general trade. Other 28% now is divided between generics. Jana Aushadhi is already 16,500 crores with 15,000 pharmacies. There are 35,000 generic pharmacies. All of them contribute to 35,000 crore turnover, and that 35,000 crore is half the price of the regular prescription. Just imagine. And then you have modern trade, which is around 25,000 crore, all the Netmeds and all the Apollos and all of them, they are big time. And then you have online, around 50 players, 5 serious players, 45 who play online. There's one company called Sasta Sundar, now acquired by Flipkart. So that's going to scale up now. And there's going to be medicines in minutes, which is going to come 10-minute delivery. So this is what is happening. So this is one change. And second change which I have been following since I joined the industry 3 decades back is this. The contribution of pharmaceuticals in a pharmacist portfolio was 90% in the 80s. Today it is down to 60% because cosmetics are now 15%, nutraceuticals are 10%, OTC and herbals are 10%. Herbals means alternate therapies. Surgicals remain at 1% for 40-50 years, and FMCG has doubled from 2% to 4%. So this has been the shift. I'll quickly take you through the company I work, what we do. So from global pharma to Indian pharma to Centaur Pharma. This is our headquarters in Kalina next to the Grand Hyatt. So what we do is, we are a fully integrated company. So API, CRO, clinical research, contract research manufacturing, formulations, R&D, we do the whole thing. Okay? And we export to 120 countries across 5 continents. In terms of ranking, we are ranked 34th by prescription in India, and we have 4,000 centurions working for us, which are our assets. If you look at contribution, 50% is exports, 50% is domestic, 50% is formulations, around 24% is API, 25% is contract research, and 1% is clinical research. These are our plants, two US FDA plants for formulations, one big for API. We are biggest psychotropic player in the world, and we also have two plants for ROW markets, rest of the world markets. These are the upcoming projects, one new for ROW, one API R&D world class, US FDA, one ophthalmological US FDA unit, and the new wing for Centaur. So that's the planning we have. So to end our company presentation, a quick note on formulations. We are across Asia, Africa, South America. In India, we are leader with 13 brands across cold, cough, ophthalmologicals and nephrology. Synarest I will be speaking separately. 1,500 sales force. And in innovation, this is one thing which I would like to speak of. Maybe I'll take a minute and a half on this. We have introduced a product for the first time in the world in India 3 years back, 3.5 years back. That product is used to treat diabetic foot ulcer. It's called a NCE, new chemical entity. Now, there are only 4 companies in India who have launched a new chemical entity themselves with research right from the ground. Only 4 Indian companies. Zydus was the first, we are the second. Vocard, with nabitromycin is the third, and Glenmark is the fourth. There are only 4 companies who have bottom-up done research, phase 2, phase 3, everything. So we have done that. We have saved around 36,000 limbs so far with the product for diabetic foot ulcer. We are very proud of this, and this for the first time in the world in India. You are aware that diabetes is the, thank you, India is the diabetes capital of world, 10.5 crore diabetics. So that's about us. Quickly I'll take you through a case study on Synarest, how we have built this brand. So we became leaders in 13 years. For the next 33 years, we have dominated and maintained our leadership. Let's see how we did this. This would be very interesting for students of marketing and pharmaceuticals in general. I'll quickly take you through the market. The anti-cold market is 1,000 crores, but it is surrounded by the painkillers market, which is another 1,500 crores, and also the anti-allergy and nasal drops market, which is another 1,200 crores. Right? So those are the combinations. 400 plus brands with the same composition in the market. Anti-cold. 400 plus brand, 1,000 SKUs, similar composition. And you have international competition, national competition, regional competition, OTC competition, herbal competition, as happens to all of us. Alright? And let's go ahead. So what we have done is, there are maybe 4 indication therapies: cold, cold plus fever, cold plus cough, nasal congestion. Against that, we have got different segments: infants, children, adults. Against that, we have got specialties, maybe pediatricians, GPs, ENTs, consultant physicians, chest physicians. All of them we are targeted with products. So there is no cannibalization, absolute differentiation in what we do. But one of the reasons for our success has been our agility. We have had the courage to change our composition to safeguard the patients. 2001, phenylpropanolamine was banned by the US FDA. It was not banned in India. It was banned in the US. But we thought that there would be a ban which would come in. The ban came 10 years later. But immediately after that, we banned it suo moto. On our own, we banned it. So we went from phenylpropanolamine to pseudoephedrine. We sensitized the doctors that there is a problem. 5 years later, pseudoephedrine, there was a problem in US. We changed on our own. 2016, caffeine combinations were banned. We changed on our own. So this has been, the agility has been our forte. Sorry. We have also done some innovative communication. We have created a mascot. The mascot was a joker. Joker for a cold brand. But joker has a red nose, which signifies cold. And joker brings relief, come what may. He makes you smile. So does Synarest. And we started this in 1994. 32 years, this is the mascot on all our brands. The second was, we constituted Anti-Cold Day. We are leaders, so we constituted a World Anti-Cold Day. We didn't care whether there is an Anti-Cold Day anywhere in the world. We constituted our own. And we made a huge success out of it. So every 15th September and a week around that, we sensitized 250,000 doctors all across India's all 750 districts. And we tell the patients there about the perils of self-medication and how to prevent cold. And also now we have a cold index. We have a heat map of all the districts in India. The prevalence of cold, cough and fever. And we share this with doctors every month like a stock index. We have got a cold index for cold, fever and cough. But there is one price you pay for popularity, which is counterfeits. So we were inundated with counterfeits in the period 2010 to 2014. We initiated 16 raids all across India, police raids, FDA raids. Somehow, and we rung in changes. Some changes which are worth showing is, one is this. We have got a heat sensitive dot on the packing. Just touch that, the color changes and the color comes back. So the doctor can easily understand which is counterfeit, which is not. We sensitized around 2.5 lakh doctors, 2 lakh first, then another 2.5 lakhs and 5 lakh chemists all over India. So now we have completely overcome the problem of counterfeits. And this is the result. We are all India number 1 in all doctor specialties except pediatricians, where we are a very close number 2. We are a leader in all states of India except Gujarat and 3 states in the south. If you look at our market share, we are double that of the next player, or maybe equal to the 2 and 3 players. And what it has happened is the penetration has increased. If you look at our reach, all 8 lakh pharmacies in India have our product. Each of them stocks 4 extensions and each of them stocks 8 SKUs. That is what is happening. So this is about us, and we have a satisfaction index which we do with doctors, 36,000 doctors, our core prescribers. The primary reason to prescribe Synarest is trust. That is what we have understood. But that trust has taken 30 years to build. This is how the brand position has come in. 80s and 90s we were known for efficacy. 2000 to 2010 efficacy and safety, because we changed from phenylpropanolol into pseudoephedrine. 11 to 15 we added the layer of leadership, and 16 plus we are trust. 10 years of complete trust. Last slide. Now what this has resulted in is 50% share in tablet and syrup market in anti-cold. 50% share for 30 years. And we are, doctors prescribe 2 brands of Synarest every second in India. Plus 1 billion noses we have unblocked in last 30 years. 1 billion, 100 crore noses. If all the tablets of Synarest were arranged in one line, they would circumvent the earth twice. That's the volumes we sell. Number 1 in India, number 1 in Cambodia, number 1 in Uganda. In addition, we have been recognized as the brand of the year 7 times consecutively. No other brand has won it even 4 times consecutively for marketing excellence by AWACS, which is the premier trophy given for brand marketing. Thank you very much. I would be very happy to take questions. No questions? Thank you very much. Yeah. Yes, ma'am.
Since the theme is related to AI-enabled personalization, can you tell us a little bit about how that is being
So
implemented?
we have done 2 AI initiatives at our end. We are on a fledgling scale today. The first initiative which we have done is institutional orders. We supply a lot to ESI, Army, all those institutions, CGHS, all of them, railways. So what we have done is there are too many tenders which come in. And with these tenders, there are so many products in that tender of each and every company. So we have appointed an AI agent kind of thing who comes there. He crunches all the tenders, all the emails together, and he brings out exactly what is relevant to us. So that's funneling for AI, one use, serious use, which we have done. Actually, there are 2 people who do this whole time. And there are a lot of errors because it's a complex thing to do. It's not an easy thing to do. So now with this, unfortunately, there could be a redundancy. But fortunately for the company, there would be more accuracy in what we do. So that's one point. Second is, we are looking at field force. We have crunched in all the data of the last 10 years into a system. We have another system on top of it. We have created guardrails around it, AI guardrails, to ensure that it remains within that. And we will soon be announcing something which is for our field force, where any query they have, they can just put it in the box and we'll tell them the prompts, what they have to put in for AI. They put in the prompt, their entire query will be looked at. So there are only 2 initiatives so far we have taken. The next round will be more about production and R&D. That's all. Any other questions, please?
Yeah, I have a question.
Yes, please.
See, from the human resource perspective, give the mic, please.
Can one of the students
Yeah,
just manage it?
coordinate.
Hello. Yeah. So indeed, it was a nice presentation with a lot
Thank
of
you.
data. From the human resource perspective, I'm just asking whenever we have a legacy brand, because I remember when I was a medical representative with Pfizer, so the passion with which we used to promote Bicosools, and currently I associate the same with Cinerist. But the new team which is joining in, their legacy or that pride, how you instill that pride component in the newcomers, because people who have been working with Cinerist or with the Centor since last 10-15 years, so they have a different level of passion. So how you merge these two things?
So we look at it in two ways. First is we have to communicate to them that they get a base which is ready-made. So they have a base which is there. They just have to build on that base. So Cinerist is something which they should maintain and grow. But new products should be their focus. Their evaluation will be on the contribution of new products in that area. That's how we look at it. Because any great company which is there, or any even good company which is there, what is the sale of new products is the real thing, not what is the sale of legacy and pillar products. It's how well you do the new products, how well you connect to the newer doctors, newer conversions, newer prescriptions. That's what builds the company. I was just discussing with Mr. Singh today about Lupin. I thought that their diabetes division would be 2,000 crores. He said it is 4,500 crores. That's how they built the brand, the entire therapy segment. And it's all new people who must have built it. That's how it is. Any other, please? Yes, sir.
Hi, sir. Thank you so much for a lot of insights. I just came from the field working from Dadar and got before a couple of days only. And I came to know that Swiggy is marketing many medicines.
Test marketing, correct?
Yes. So now you being from the IDMA, sir, I just wanted to know that what are the government's policies to restrict all these online things like Swiggy so that we can avoid the misuses of the medicines.
Okay. So there are again 2-3 perspectives on this. Let us look at the patient perspective. Suppose I am 80 years old. My children are settled abroad. Okay, me and my wife are living alone, good house, everything fine, good neighbors. I am there. But I have some ailments, I can't get down every time, go to the pharmacy, get medicines. Would these kind of things help me? That my son or daughter just clicks it, knows the medicines I want, clicks it, I don't have to pay, I get all of my medicine supply for a month at home. So that's the plus point. Let's look at the pain points. Like you are saying, so there could be counterfeits, there could be so many things. But that's where the regulations come in. I feel it's a positive step to have it. And another objection is from AIOCD, who feel it's a threat. So I would request that if AIOCD also comes into this and helps this as partners, it would be a win-win for everybody. Because the kind of reach which the retail trade has is huge. And you need a physical point there to service that market. Online cannot be through a depot in somewhere in Bhiwandi to deliver in Dadar. It has to be in Dadar. So they have dark stores, which all these, they call quick commerce. All these quick commerce have got a concept of dark stores. Dark stores could be a house in a building where no customers come, but goods are stocked, goods are taken and delivered. So that concept, I feel that there should be a policy which helps this, facilitates this. There should be the trade which supports this, and there should be